Nasra, hi. Thank you and welcome back.
Okay, I would wish to have only 2 questions for Nasra. Then I'll keep quiet.
Okay, I'll go for you. Okay,
So,
sorry, Peter.
Nasra, at the first time when you came to my live stream, I asked you about possessing a car from Changa Bati and you denied, right?
I denied, no.
I also asked for the papers, the medic. I also asked for medical record about you so that we can help you. Did I ask you for the records or not?
Cannot remember.
No, but you have told Mtandao that I have not asked you.
Yeah, I cannot remember anywhere that you asked me for the results. The only place that tulipatana na wewe was ile time yenye people were trolling me. That is the time yenye tulipatana na wewe about the results. That is the time that yani we communicated.
So
Nasra, I want to remind you of the series of events and the genesis of the whole thing. You texted me on 14th ukaniambia, hi, you need my help. Did you text me last year?
Yes. Yeah.
I told you that let us first finish this issue of Otuoma, then we'll come to you, right?
Mm-hmm. Yeah.
After that, you came again to ask me. I remember it was 1:05 a.m. Kenyan time. And you asked me the same. Nikakwambia, tulia, we are going to do that for you. Right? I came, I gave you a platform and I asked you for the medical records. And after asking me for medical records, you said you have none. You only have Saudi papers. Is that true?
I think I have Kenyan. I have the Kenyan as a Saudi pia.
On the day that we were together on the live stream, you say that you don't know where other papers are, but you have kulikuna unatoroka mahali and you had a rush.
I didn't know where the papers were, but niko nazo. I have them.
Thank you. Okay. I would wish you to understand that maybe labda kichwa yangu ndio mbaya ama maybe hospitali naenda ndio zinaandikwa hivyo. Wakati umeandikiwa vipimo za kwenda kufanya unapatiwanga iko na stamp ya hiyo hospitali, si ndio? Hiyo yako tuoneshe. Sijui kama iko nayo.
Itakuwa sasa nilitoa wapi? Si watu walikuwa nasema hadi ni eti nimeitoa, sijui nimeenda nikaprint.
Ikiwa nayo iko sawa. Tunaendelea tu mbele.
Thanks for this. Nasra, any of those papers will have a stamp, right? They should.
Yeah. I can show any stamp from this paper.
It's very hard to verify from here, but I'll see.
It is.
Peter, one thing we agree is she's not well. We do know that, isn't it?
You cannot recognize someone because you're looking at them.
Well, you talk about the Saudi Arabia papers.
You cannot talk about someone's sickness while you're just diagnosing them through your eyes. You don't have a scanner.
Nasra, do you have the Saudi Arabia paper, the paper from Saudi Arabia that show the
where I'm asking about the paper that referred you to KU and as well as zile ambazo ulikuwa umeambiwa pime.
Did you hear that? That's what this one. Nasif, can you hear me, Nasra? Well, listen, Nasra, if I'm not sure what happened there, but listen, Nasra, these people, they do care, and that is what they're asking these questions. For anyone else here, guys, if you ever ask for help publicly, you must.
No podcast. Let me tell you what happened. Whatever. I called. So someone was texting me akiniambia Nasra, tulishaenda mahali documents ziko na yeye, wakiwa na yeye na watu wengine. So yeye alitumana on behalf. So Nasra, wakati KU ilisema walimwambia kwamba sijui vile ilifanyika, but sitaki kuongea mambo mingi, lakini baba Talisha alikuja akaniambia nisirudi kumhusisha kwa history tena, kwa sababu alipomchangishia alienda kununua gari, alimchangishia akaenda kumnunulia gari, akaenda kununulia boyfriend wake gari na akamwandikia logbook, kila kitu. There is a lady called Maua Media here. Maua Media, how are you?
She said she tried to join, not sure why. Oh, she's dropped again. So what's up with Maua Media? So she's involved as well. She knows Nasra.
Maua Media is actually from her home, so she wanted to say everything. And again, mimi sitaki mtu judge, iko hivi, hatuwezi kwenda kukuchangia ukanunue gari na mwenye anakuchangia hana gari. Kama mtu kama mimi natoa shilingi yangu 10 nichange, alafu huyo mtu aenda kununua gari. The same case happened with the Shepherd. Wait, the same case happened with the Shepherd. Tulichanga, kumbe the total amount tulichanga akituambia 3.4 ilifika 15.9 million. Umesikia? Unasikia?
I'm listening.
Mimi niko hapa nachangisha kwa platform, alafu mimi naenda kuchangishia mtu aenda kununua gari. I swear before God, mimi mtandao na kuomba uchukue hii kesi ya Nasra wholeheartedly.
No, don't say that.
Let not be.
Peter,
yeah.
No, don't say that. Listen, all of us, you guys have interacted, okay? You told me you cannot diagnose by looking, but she's got papers here. I mean, what else do we want? Nasra, come back, please. Nasra, what to this story to Nasra, Joe?
Up her, bring her back to show her the results and everything. Therapy.
That's right, correct. And yes, I'll be very interested to hear that too. Well, Nasra, we have a few more minutes. Nasra, if you cannot come up to Mazatu story up too, because listen, this is your story, Nasra, and as I said, you're very, very protected here. You came to say your story, and you agreed, to interact with questions, and these are things people are asking, and so please do come up, Nasra, come up too. Anyway, Dula, you've been here for a while. Hi, Dula niaje Buddha. Okay, let's see who's want to see her now. Okay, lots of people are coming for questions. Nyar Bunyore, hi. You had a question too. You want to say something?
Hi, Mtandao.
Well, thank you for coming up. Where are you calling from?
Nairobi.
Okay, Safi. You've got a question. You want to say something in this particular case?
Well, yeah, I have a few things to say. Like, I've been hearing of this Nasra's case, but I mean, Mtandao, even by the way she's behaving on here, you can tell there's something amiss. And I honestly want to agree with Peter that and everyone else on the comment section, because guys are asking if truly she's unwell and she needs help. Why is she behaving? These are red flags. The red flags are all over the place. Because if I need help and I'm truly sick, definitely I have the papers. Why can't I present the papers for verification so that people can help me? You know what I mean? And the idea of her akichangiwa and then she went to buy a car, it's something that sorry about that. You can hear me?
I can. Yes, carry on, please.
You can hear me, right? Okay, a call came through. So I mean, that's something that I've also heard. It's grapevine that has been on the streets for quite some time, and you can see from the way she's behaving, anakuja anateremka, because why did she see Peter na akateremka? And one thing with Peter Kioi, he might have his challenges, but he does tell the truth most of the time. So I want to believe him on this one.
What was to believe who? You talking about Nasra?
No, I'm saying Peter.
You about you?
Peter, I don't believe Nasra. I don't believe Nasra at all.
Right. No, listen. As I say, what I can do is just listen. But thanks for that. I appreciate it. Nasra, we've got 5 more minutes. Otherwise, we
get. Huyu mwenye amefungua kamera ni boyfriend wake ama nani?
Simon, hello.
Hi.
Hello. Thanks for coming up. Where are you based? Where are you calling from?
Niko Kiambu.
Okay. And you want to say something about this case? You know Nasra?
Mimi nishawahi muona, but nilimuona wakiongea na Peter Kioi.
Wapi, kwa mtandao ama nje?
Kwa mtandao.
Wako na kuhusu nini aise?
About hiyo tu mchango, but yes. Zile maswali Peter Kioi alikuwa anamuuliza hizo document yako alikosa.
Yes.
So sasa mimi sijui kutoka hapo kulienda aje.
I see. Okay.
Now, up Nasra.
Yes,
up Nasra.
Yes, I've done that. I've sent the request. Nasra, kama tumalize tu story. Nasra, you're very...
Yani tuko kwenye maswala, yani wajua nakasirika yani. Tuko kwenye maswala, yani maswala ambayo hapa ni tatanishi, lakini wewe hapana, unawasha kamera, unasema ujue kuliendelea vipi. Yani na unatuwasha kamera. Yani wajua tunakasirika sisi hapa juu. Hebu shuka bwana.
Dula mpe nafasi. Nasra, please come out to this story, Nasra. Come on, ama ni credit Nasra. Tuma credit tu. Ameenda wapi? Hey Nasra, come up if you can, please. Nasra, come up if you can to this story too. Who else wants to say something?
Mtandao.
Mafla, hello.
Mtandao sina wifi. Wacha niongee kidogo alafu nishuke niwachie wengine pia waongee.
Please.
Mimi venye naona hii story ya Nasra, ukweli huyu msichana alikuwa mgonjwa. Na hata saa hii tunashukuru Mungu kama mimi. Saa hii ako afadhali venye alikuwa kitambo. Tunashukuru Mungu juu mimi naona kama health yake at least leo ako afadhali anaweza ongea. Tunashukuru Mungu. Lakini kusema ukweli huyu msichana alikuwa mgonjwa. Second, huyu msichana alikuwa anasema boyfriend yake alimmess. Huyu msichana anasema hiyo gari alikuwa na boyfriend yake alikuja na idea ati wakinunua gari at least hawatakuwa wakikuja wakiomba hapa TikTok, itakuwa itawasaidia kidogo ya machakula nini, mambo ya kulipa rent, hatakuwa akiomba kila siku. Lakini hakuwa najua intention ya huyu baba, huyu kijana ako aje. Unaona? Kwa hivyo watu wanayataka kumess, ukifikiria wanakusaidia na kumbe kuna Kenya anataka. Kwa hivyo mimi sioni ubaya ya huyu msichana sana, so long as kama anaweza kuwa na document mzuri yenye iko straightforward, msaidie huyu msichana aende hosi, atibiwe, apone, na watu wa TikTok tutashukuru Mungu.
Mafla, I think I agree with you, Mafla, on that. I mean, from what Nasra said here, to be honest with you, I cannot judge. Mafla, thank you for coming up. Nashukuru sana Mafla, thank you.
Asante sana. Wenye wanasema nataka kuongea wenye wanasema sijui gari. Huyu msichana ame-explain alikuwa ananua gari, hiyo gari ilikuwa naweka kwa biashara ndio at least imsaidie kidogo. Akose asikuje hapa kila siku ni mgonjwa akikuja kuomba. Alikuwa amenunua hii gari in good intention, lakini hakuwa anajua mwenye amenunua gari iko huyo baba mpango yake ya nyuma ilikuwa aje. Kusema tu kweli huyu msichana ni mgonjwa. Saa hii at least naona Nasra at least ume improve kidogo, na kuombea Mungu wakuponye kabisa na kupee haja ya moyo wako. Asanteni. Msaidieni huyu msichana kama hako na document mzuri aende hospitali.
Mafla uko kwa comment section. Naona umeniandikia tukurudisha nyumbani, si ndio?
Hii ilikuwa ya Nasra Peter, hii mambo ilikuwa ya Nasra. haikuwa
Nauliza tu
yangu.
ndio because hatutakutana tena siku nyingine because najua nimekublock. So nakuuliza umesema tukurudishe nyumbani?
Why will you block Masla?
Yeah, so Mafla, kama ni njia ya kurudi nyumbani umekosa, Google Map iko, it will help you.
No, Peter, stop it.
Hapana.
No, Masla is okay.
Peter, haikuwa hivyo.
Mafla-
Haikuwa hivyo. Mimi nilikuwa nataka tu usaidi. Lakini saa hii mambo ni ya Nasra jamani.
Yeah. And
Wacheni tu hii mambo
Mafla, thank
ikuwe
you.
ya Nasra.
Mafla, thank
Ikuwe ni siku yangu.
Mafla,
Please.
thank you. I appreciate it. Thank you, Mafla. And I'm going to drop it down now. Thank you. Well, listen, friends. I mean, we've been here for 2 hours now. And
Mtandao, can I say something?
please, Nyamasa, yes, of course. Hello, great to hear, by the way.
Good to hear from you too. This is what I want to say about this girl Nasra. Me, I knew her through in Baba Talisha's live, tukachanga pale. The other time I saw her, I saw her in Peter Kioi's live. About the treatment, mi deal na mambo za hosi sana, so I've really worked in KU sana.
Correct.
Na kama ushaenda huko hosi, the record inakuanga pale, ni kuprintiwa tu utaprintiwa. You understand? So for me, I think she deserves somebody mwenye atampeleka pale hosi kama documents. You remember this guy called, there is this dready guy Budohi.
Yes.
You remember wakati alikuwa anasema nini yake iko KU kwenda pale, the files were not there. That guy was going there for a therapy, not treatment. So in a different case sana. So when we speak of cancer,
Yes.
honestly, go to cancer wards ndio utajua hii kitu si jokes. So please tuache hii con games hapa. Let her go back to hospital. We will support her. By the way,
And
for me,
Nyamasai, I know who you are, and I know you do this kind of treatment. So do you genuinely think that an hospital could leak results?
no. Without her permission, it's a no. In fact, the moment she mentioned that thing, I realized that's a scam. Hakuna mtu anaweza pia document say
Especially
not unless kama ni guardian mzazi
hospital.
ama mwenye ulienda naye pale.
That's what I thought too. That's what I thought.
Especially in a Kenyatta hospital. Kenyatta is a very big hospital.
No,
A
it
very
was
good one.
Kenyatta University.
Yes, kumekuwa na mess mbili tatu, but when it comes to cancer, trust me, wanakuanga very serious. So please, tuache hii con game and we are past this. Na arudi tu hosi na msei mwenye anamjua, kama kuna records zake pale zifuatiliwe, tujue tutaanzia wapi. Let's start a new game. Wacha tuanze kitabu ingine mpya. Kusema kweli watu wamemjudge sana hapa na atujui the other side of her. Yes. Because tukimuitisha hapa document haleti clear documentation. So please, arudi tu hosi. Alete, yes?
Just on that, hata ndio kitu nilikuwa nimekuja kuuliza.
Yes, alete tu clear documentation. That's what we need, mtandao. Yes. Sahi hatuna time na nini. When it comes to ugonjwa tusicheke nayo. That's not a laughing matter.
And I think I'm with you on that, or everyone. And I've sent
Nasra. Yes. Ugonjwa as a person whereby tuko na mtu mwenye ako na cancer. My aunt has a cancer, and I can tell you things we go through as a family. Hey, bro, it's not a joke.
Listen,
so please, Nasra, feel free, come here, tuongee, yes. Tuambie uliachia wapi KU. We have doctors there whereby wataweza kukusaidia in one or two things na utasaidika.
Yeah,
that's all.
That's true, and thank you for that. Listen.
Lakini ngojeni, niko na swali. Unaona last time tulikuwa kwa Peter, tukakuwa na hii kesi na watu waka-agree Chazi atachukuliwa, ataenda mchukue Nasra waende.
Tandao, hebu pandisha Nasra. Pandishe.
I have, but I don't know what's coming up. Nasra, come up, Nasra. I've sent the request several times. Nasra, kama ni bundles, Nasra, sema tutaweka tu. Hey, Nasra, if it's a bundle, sema tutaweka kitu hapo tu. So just comment, Nasra.
Let me tell you, mtandao, cancer drains. Cancer mtauza kila kitu. Cancer.
I know exactly what you're talking about, Nyamasai, and that's when we started the podcast. I did say that when people are going through health struggles. People are so confused. There's no logic.
To be honest, if she is real, we are here to support her personally.
And say, look,
Mtandao, up Nasra.
I have.
Up Nasra.
Anasema anampandisha na
kuji, lakini Nasra wacha
Nyamasai, acha ni kujibu.
Guys,
yes.
Tumeongea.
Yes.
Nyamasai, the last time Nasra was being grilled on this platform, we agreed because we realized that hakuna makaratasi. She has nothing except ile paper ya kuonyesha akona something leukemia. So it was agreed that she has to go. Even Peter Kioi said, I am going with you. Are you ready? We do this. Because he asked her about all the papers she could not provide, and people started making noise. So we agreed that Nasra is going to meet with people from TikTok, alafu waanze hata process afresh.
Okay, friends.
Afresh kabisa.
Okay.
Sasa mimi nilikuwa na
Mtandao.
tusikie walipika wapi.
Mtandao, mimi kama ni means of transport, ninaweza toa gari yangu moja, nimpatie, apelekwe hosi na arudishwe, afanyiwe hizo testings zote, wajue, we need to know what is, ni nini inakula kingine pale. Umeelewa?
I totally agree. And when we agree with this,
yeah, so please, cancer is not a joke. By the way, you people, it's not a joke. Now, by the way, Nasra, if at all you're sick, come up, explain yourself. Tujue tunaanza wapi jamani. Hatutaishi hapa game ya Nasra A, Nasra 2, Nasra 4, Nasra 9. No, that's not a game.
Thank you, guys. Nyamasai, thank you. And Mulava, thank you very much. Who else says before we end this? Nyabunyore, you want to say something? Nyabunyore, I'm sure. I hope I
Wanted her back up here.
I have sent her.
Wanted her back up here. And she keeps on requesting. Si anasema na request. So ni nini mba, you see all the red flags tunasema.
No. Let's be kind. Okay? I don't know, could be.
No. I'm kind. I'm not being harsh on her. I'm just saying if she keeps on telling us, sorry.
I have sent her the request. Let's see if she can come up again.
Mtandao, maybe.
Okay.
Mtandao, maybe unajua pia yuweza kuwa anaogopa kukua, anaona kama atakuwa grilled up, unaona?
No.
Mimi hata nishuke nikae hapa kwenye comment section. Mimi nitakuwa hapa kwenye comment section.
I do appreciate you coming up. Nashukuru sana kabisa. Tunatomsaidia tu. I mean, Nasra, listen, all these guys, they do care, and I don't see anyone who is trolling. Okay, no one is shouting. They've lowered their voices, and Nasra, as I promised you, that this podcast will be about you and your story, and that's where I am at. I'm not judging anything. It is about your story. Okay, you coming here, you have honored my invitation. So if you're still here, Nasra, please do come up. If you want me to. Nasra, please do come up. If you want me to drop anybody here, I will do that. You see, it is your story, Nasra, and that's why we are here. People write it to me up, Nasra. Friends, I have sent requests to her several times, but I don't know why. There you go. Nasra, I've just sent you request now. There you go. I've sent a request again, Nasra. Up if you can. The Masai, Charmaine, hello. You want to say something? Charmaine. Okay, muted. Seattle babes. I was that's the right one. Oh, Charmaine. Hello, Charmaine.
Hi.
Thanks for coming
everyone else.
Wait.
Thank you.
Mtandao, I will drop so that I can wait for her to come up. Then I will be tapping.
But Peter, thank you for coming up. I appreciate it. Thank you for that respect. Much appreciated. Thank you.
Mtandao, let me drop as well. Better to tap.
That's okay. Charmaine, you say something?
Yeah, I want to say something.
Please, we are
very brief. What I can say about her case is that she might be sick because we're not sure if she's really sick, but by the look, she looks sick. But then I don't see the reason as to why when someone is sick and they need help, people offer to give them help genuinely, but they don't want to take the offer. Because in this platform, we have seen a lot of people who are sick and they come up with verified documents from hospitals and, they get helped. But then I don't see the reason as to where we get to a point when we're asking for the documents and out of nowhere, the documents are nowhere to be found. Every time they ask for the documents, it's like, I don't know, they kept them in the bedroom and they're not there. I don't know where mom kept them, It's just not adding up. That is like it. That is what is bringing all these Nini stories and everything that is going around. If someone wants to be helped, because the other time they offer even to take her to the test and hospitals, and she refused. So if you want help, you want TikTokers to help you, right? Then that means the TikTokers have to participate in all this. It's going to the hospital, they need verification and everything. You don't just come and expect to be helped, but then you don't want to commit and
Thank you. Thank you. And I do agree with your sentiments. Thank you for coming up.
Mtandao, and if at all,
you cannot drop.
Mtandao, and if at all story ya gari, the boyfriend went with her car. In Kenya, or in the current generation yenye tuko, hakuna kwenda na mali ya mtu. You understand? If at all she had document ya hiyo gari, we can still reback that car.
Correct.
You understand?
That's a very good. That's a very good.
Because saizi when unaenda na gari ya msea nini, honestly.
Well, anyway, she's here now. I'm afraid I'm going to drop you guys. Let me have a discussion. Thank you for coming.
All right.
I appreciate it. I do not say, guys, all those who are coming up here, guys, thank you. And I appreciate the decorum and the respect that you've given to me. No one is shouting. We've all listened. So thank you guys for that. And in the comment section, you are behaving now. I do not take that for granted. Again, for those of you for the first time, I make podcast on soft skills. Today, I'm not alone. I am with official Nasra sharing a story with us. Now, Nasra is back here. Before we end this podcast, I've got two announcements. One is Kenya TikTok Got Talent is back. Come on April, we shall start the live shows. So if you have any talent, you're a dancer, you're a musician, you're a comedian, any talent, okay, you are invited. The winner walks away with 100,000 Kenya shillings. For those that want to support the show, please come forward and we shall agree on terms. But we want you guys to be part of Kenya TikTok Got Talent Season 4. So those who are interested, please write to me. Now back to you, Nasra. Again, thank you for coming up. Nashukuru sana Nasra too. So Nasra, as you can see, all these guys, they love you. Okay, everyone wants to help. And for me personally, I understand, used to the guy, I can see why that will have happened. Now, question to you, official Nasra now. So you have the documents that shows you've been diagnosed. If anyone wants to represent them, isn't it?
Yeah, I have here they are.
Correct. I mean,
a camera.
No, Faith, I'm not faithful. Faith, I'm going to be very brutal now. Faith, don't do that. Faith, please, can you apologize?
Okay,
Okay. So what was that? You mentioned. So that's the test that you have taken, right?
Yeah, I was told this is the test that nafaa kufanywa. Nikaenda nikafanywa tena kuendea resort hakuna. Here is the paper that I went. See, this one.
Okay.
Ni a biopsy and this is the doctor that mwenye alinifanyia ndio huyu.
Okay, what's the date? Can I see the date? What's the date there? Guys, I cannot see friends. As I say, guys, I'm not. Okay, I've got to accept this. Okay, I've got to accept Diana. Obviously, yes, Diana, I've got to accept you. Thanks for coming up. So listen, guys, my podcast. I'm not investigative journalist. Okay, that's not what we're here. We're here to share another story. And you guys ask for evidence, and I can see the papers there. I cannot verify it. So guys, please do not use me. In any reason, I cannot verify what Nasra is showing us. Okay, that I cannot verify whether it's true or not. Diana, first, thank you for being here and a very happy new year to you.
Yeah, hello. How are you? Someone need to come in, but I'm in the office, so I thought, you know what, let me come in. Maybe there's something I'm supposed to know. What's going on?
Thank you. Thank you for coming up. Just a quick question. Well, not a question really, but this girl here is not well, and she goes through a lot. One of the things is that TikTokers fundraise for her. For some reasons, she ended up buying a car so that we'll be able to support their health journey. But that didn't go as per plans. She never mentioned this to any TikToker that helped her to get the money. But this car is taken away by the boyfriend. And you as a person that, I know what you've gone through. Can you see any logic here where people can fundraise for you and then you feel like actually, instead of doing X, let me buy Y so you can help me to provide for X? Does it make sense to you? Is it logical?
Okay. There's something I see from the comment section, and I don't know much that has been spoken, but I will just give my opinion as someone who has had cancer. All right.
Correct.
I've seen Nasra. I've just come in now, and I've seen you. Everybody is saying they're ready to help you, and they need documentation. And the documents that you've just shown right now, you've shown a document requiring for you to take a test and a document, a biopsy, all right? As someone who has had cancer, who had a biopsy done, there is a difference between biopsy and diagnosis, okay? So a biopsy is a test. And after a test, there is a final diagnosis. When I had biopsy on my breast, that did not say I have cancer. It is just going for a biopsy. It's just going to a lab for a lab test. All right. And the fact that you've been on this platform, I think, for a little, even more than 1 year, going 2 years, saying you had, I think, blood cancer, I believe, it means you had a diagnosis done at a certain point in your life, right? I believe those are the documents that these people want to see. They don't want to see, document asking for you, biopsy, or document. If today I would produce a document, I'm going to get onto my file and I'm going to bring a document saying diagnosed with breast cancer stage 2, triple negative estrogen. It is going to give all those details, and it is going to say the hospital where the diagnosis was done and the treatment plan. I believe that is what these people want to know. So for you to know you have cancer, you have a document that says that. Leave alone these other ones. You have a document that says that. And then number 2, I would advise you, because I really wish that fellow cancer patients and survivors and thrivers just become straightforward. Just tell these people everything. For instance, if you are maybe stage 2, stage 1, and you seek treatment, let people know, okay, I have been diagnosed with this. This is the hospital. For instance, in my case, I would say, I have been diagnosed with breast cancer. My hospital is MD Anderson. This is the amount, the need for my treatment. I don't have insurance. And I will give that. Now, in your case, I don't know what stage it is. If it is stage 4, if it is stage 3, whatever stage. Stage 4 may be a terminal person who is not undergoing treatment, that is undergoing management. And that is what I've seen a lot on our platform, Tandao. Cancer patients need to make it clear for people, all right? If it is stage 1, 2, 3, sometimes those are treatable. So they need to give somebody, okay, this is what I've been diagnosed, this is the treatment plan. Share what the treatment plan is, and people will know what they need to help you. If it is something that is not treatable, and I'm not talking about you, Nasra, in this case, let people know the truth, because donors normally suffer donor fatigue. If you don't tell donors that the type of cancer I am, it is a managed cancer, not treated cancer, but managed. So that means you're somebody who will need help continually. It is not going to end. So they will not develop that fatigue. They may even decide, some people may decide to put it in their calendar that each month they will be visiting you or sending some food your way or sending something your way. All right? But if it is treatable, they will know that it is something that they're doing once and that's it. The treatment plan is there's chemotherapy for 3 months. Like my own treatment happened 4 months, it was finished. So I cannot go back and tell people, hey, help me, I'm on treatment. No, it got finished in 2021. If at all cancer reoccurs and comes back, and maybe I'm told this stage 4, it is on my neck, it's on my head, it is everywhere, that will not be treated cancer, it will be managed cancer. So I can you help me manage this? Can you help me with food? Can you help me with this pain medicine? I'm going to maybe hospice, I'm going wherever, all these things. So if people are saying it is stage 3, that is usually in between. It can be early stage, it could be late stage. It normally depends. I'm not your doctor. But if you are somebody who has been diagnosed, give these people the diagnosis paper, yes, and let them help you. Please, because many of these times people just look for me on my WhatsApp, hey, Diana, come here. So I had to come. But please, they want to help you. Just give them the documents. Don't give them documents that are not relevant. Give them relevant documents for them to help you. I hope this helps me.
Diana, thank you. And you've put it, well put. I cannot add anything really. And that's exactly what we want to do. And one thing that I like is about donor fatigue. People are so tired on this platform. Just for the last week, there were like 3 funerals on this platform, and the same people are the ones who are contributing. So, thank you for mentioning that. And I hope not just Nasra, but anyone else who's listening to me, guys. People get tired, so you must make it easier for supporters. Because we've been here for 2 hours, and I am absolutely knackered. So Diana, thank you very much for coming. I really appreciate it.
Let me go back to that. Thank you.
Thank you. That's Diana, guys. One of the most inspiring TikToker. If you're not following Diana, you want to do that. Diana is one of the most inspiring personality on this platform. Okay. Ninyamaze kwa. Okay. Nasra, now. Before I let you go, so are you on chemotherapy? Because people are writing about chemo. You cannot do chemo if you're not diagnosed. So,
All that was done when I was in Saudi. So that is where I was diagnosed, and huko ndiko nilianzia medication, and I was in a hospital in Damam complex, and then I was transferred to King Fahad. Where Damam complex inaendangwa tu na foreigners, but when you have a serious issue, ndio inapelekwa kwa hiyo King Fahad. Like hapa Kenya, when you're having a serious issue,
So carry on. So you've got from Saudi Arabia, you've got a paper that says you have been diagnosed.
Yes. When I was in the hospital, that is the time that walisema nimekuwa mgonjwa, and I need to be taken back to my country because it's a serious thing.
Right. So and why? So when you went to KU, they saw those.
Mtandao.
Yes.
Mtandao. I have a question to you. Then you ask Official Nasra. Maybe she can get you better. I'm asking. Now that she has stage 3 cancer, where are the documents that shows the diagnosis was stage 3 cancer, and where did she obtain them from? In Kenya. Forget about Saudi. Now that she's in Kenya, what did she do since she came to Kenya? Because what are you treating if you don't know that you are stage 3, or where are they? Show us diagnosis results.
Listen, Peter. You don't have to take me this fast, bana.
Talk through me, Nasra. Talk through me, right? What do you want to say, ma?
So Peter anasema eti what shows ama ni wapi naendanga hospitali ama nini. When I was in Saudi, I was already on treatment. I was undergoing treatment. So wakati wenye nilikuja huku Kenya, the doctors said they have to start 0.
And have you done that? Do you? So again, we're just repeating ourselves, Nasra. I'll ask you. Hang on, before I ask me a question, Peter, are you satisfied with that?
Okay. First, let us show any results from any hospital in the whole world that shows that she's stage 3 cancer.
Well, Nasra, you've got results showing. Nasra, can you hear me? One second, Nasra. I know you're getting tired. I know that. But again, so do you have a paper, Nasra? I'm not asking this again. I'm going to ask Tena. Do you have any paper saying the diagnosis you have? Forget what they said, you 1, 2, or 3. Just saying this guy is suffering from X, Y, Z, and these are the tests that were done, and these are confirmation. Do you have that, Nasra?
The only paper that I have is the one that nilishikwa na polisi. The rest, si nilikwambia like nilikemboa alafu nikashikwa tena.
Yes.
So when I went back to the contract, that is where I lost
This is my question. Ni kama nipate na Kiingereza, wacha niulize kwa Kiswahili. Nasra, naomba utuoneshe iwe Saudia ama wapi, tuoneshe dunia mzima yeyote, hospitali yoyote, results ambazo zinaonesha unafaa kutibiwa stage 3 cancer.
kitu yenye niko nayo, I only have a paper that I'm being deported to Kenya because of the history of the cancer that I have. That is the only paper that I have.
So okay, Nasra. So Nasra, nani alikuambia uko na stage 3 cancer? Nani alikuambia?
Doctors from King Fahad.
Iko wapi barua ya King Fahad kuonesha uko na stage?
Wacha nifanye rahisi kwako kidogo, Nasra, kidogo dakika moja. Wacha tu nifanye rahisi ndio uelewe point ya Peter. Umetuambia ulipokuwa kuko Saudia, bila ulifika Kenya, uliambiwa you start from afresh. Hapo sasa ndo tunaanza, ndo maswali yanaanza. Ulipoenda kwenye hospitali ukaangaliwa, ukaasesiwa, aliyekuambia una cancer stage 3, yani hiyo document ya kuoneshana ni yes, ni ulienda hospitali from the start, from the word go hapa Kenya. Sasa hapo mali uliandikiwa una cancer stage 3, una hiyo document? Unayo? Hiyo ndo swali rahisi na ndo tunataka kujua. Kama
hiyo ni kuna cancer na iko stage 3, it is in Saudi, not in Kenya.
Okay.
Nimekuambia wakati
nani Nasra, it is a yes or no question. We are not in Saudi, we are in Kenya. It is a yes or no question. We are in Kenya now.
I have never seen my result. I don't know who went and took it. I've never seen my result.
So mtandao we can conclude maybe hakuna mahali popote Kenya alifanyiwa any assessment.
Okay, guys, okay, I need to drop. Okay, I'm not answer kidogo tu. Chahazi, hello, hi. Thanks for coming up.
Yeah. You know, I'm here because I've been with Nasra for a very long time na complication ufika tu mahali inaanza tu tukifika hapa kwa papers. Last time I was with Kioi and Kioi told me Nasra amesema huwa anatreatiwa KU and we said let's forget about everything. Mimi ni mchukue, we start afresh. You know? Tuli conclude na huyu Kioi. We were with Kioi and the people who were there walituona kwa live. Kioi akaniambia enda uchukue Nasra kwa mkono, umpeleke mwanze afresh, yani aweze kusaidika mtandao. Everyone loves Nasra, but now wakati inafika niende nimchukue tuende tuanze afresh. Nasra alikasirika, akashuka kwa live akakataa. Unaona, ikafika sasa tumekuja kukutana tena and I was to take Nasra to the hospital tuanze afresh. Hiyo maneno ilikuwa wapi? Where did it go? Because last time she was at
mtandao, because I don't want a heated conversation here. I want to be very professional and I want to be very I want to be in a very simple language. Official Nasra, nijibu swali zangu 4 niende. Moja, who prescribe your medicine that you are taking?
the doctors.
Wapi? Hapa ama Saudi?
Wapi? Hapa Kenya. Who prescribe your doctors? Your medicine.
I got different doctors. Kuna mwenye alinifanyia biopsy anaitwa Dr. Sumba and there is anaitwa Joseph Sumba and there is mwenye ananiandikanga the prescription ya kuchukua.
Sawa, daktari anakudiagnose kwanza, result inatoka, alafu anakupatia dawa. Sasa naomba utuambie alipokudiagnose alikuonesha result gani ndio anakupatia dawa gani?
Hakunipatia result. After
alikaa nazo tu.
Kiza after kupimwa, that is the time that after nimeenda amenifanya testing, I had the results na watu wengine. By that nilipigiwa simu nikaitwa police station.
Ulisikia ati you had the results with watu wengine?
They were leaked.
Yeah, the result alikuwa na
Okay.
watu wengine.
Nataka leo face camera useme ulifanyiwa diagnosis. Ngoja kidogo. Ulifanyiwa diagnosis hospitali gani? Branch gani?
You mean test, Peter?
The diagnosis was done in Saudi.
So not in Kenya.
Yes. Zake you?
Zake hiyo mimi hata sijaiona document hata moja. Sijawahi hata yenye walifanya.
Nakuuliza diagnosis ya Kenya ilifanywa wapi?
Si ni KU, sijaienda hospitalini.
KU wapi? Gani? KU wapi? Kahawa West. Ulifanywa diagnosis na daktari mgani wa KU?
Mwenye alinifanya anaitwa Dr. Sumba, and huyo bado ni early request for the 16 test, and after kuchangiwa I didn't go for the test, and yeah, we started looking.
Au kuenda kwa test?
Siku after sasa nimefanyiwa hiyo mchango na babati, after I went to the hospital nikafanyiwa biopsy, and then after the biopsy the doctor told me to tell my people wakuwe ready na pesa, and then ndio sasa akaniambia hizi 16 test. When I came sasa ndio nilitafuta babatalisha, and then I didn't go for this test.
Naulizwa ulifanya PET scan? Ulifanya PET scan?
No.
Nasra. Receipt yenye umetuonesha ilikuwa ya nini? Yo material?
Yenye nimeonyesha si ya biopsy. Hiyo ndio PET scan.
Ya Kenya?
Yeah. Kenya.
Okay. If today we decide again to take you to KU, will they find you in their computer?
Sure, yeah.
Good. Okay. Ulisema kwa post yako ya TikTok ulisema umemaliza chemotherapy. Hapa Kenya ulikuwa unaenda wapi chemotherapy?
Nikuenda.
So ulimaliza tu nyumbani?
No, when I was in Saudi nilipata dawa.
Wachana na Saudi, tuko hapa Kenya. Umepost ukidanza ukasema I'm done with chemo. Yes.
Yes, I'm done because people walikuwa wanani pressure sana all the time. They are pressuring, so I had to tell them I'm done. Waachane na mimi.
Okay. Wakati ulipatiwa pesa 450,000 na babatalisha na ulikuwa na 16 test ambayo ilikuwa inahitaji 75,000. Ukaenda ukanunua gari ya pesa ngapi?
Okay, gari ilikuwa inauzwa 370, and wakati wenye tulikuwa tununua gari, unajua sasa nilikuwa nimeambiwa nikuwe ready na a lot of cash. And you know cancer is not a joke, so that guy akaniambia tukinunua hiyo gari yeye ni driver, atakuwa anabeba na yenyewe, atakuwa analeta cash home kila time, atakuwa ataiandikisha hadi kwa Uber. And
so nimeuliza swali, nataka tukue precise. Ulipatiwa 450,000 kwa babatalisha, alafu ukanunua gari ya pesa ngapi? 350,000. Ukabaki na 100,000. Test ilikuwa inataka 75,000. Ulifanya hiyo test ya 75,000?
I'm afraid.
Yes.
Ngoja nikwambie. Ngoja Peter Kioi, hata tuktuk haitoki 370.
I'm afraid I'm going to drop you guys, okay? As we've been here for 2 hours.
Mtandao. Hata tuktuk haitoki.
Guys, we've been here for 2 hours. And look, I've been here.
Swali moja tu. Swali moja tu.
Okay. Quickly, Tony.
Please. Mtandao, dakika moja tu.
Okay, Sonia. Okay, so
mtandao.
Yes.
Wewe unajua tu nimekuwa unajua mtandao nimekuwa patient wa cancer. Huyu msichana anasema alifanyiwa biopsy. Ulifanyiwa biopsy? Ulifanyiwa MRI?
Aki, please, unajua sisi watu wa kansa vile tumeumia. Ukisema uko na kansa, please don't joke. Usicheze.
This is my point, Mtandao.
Don't joke. Don't joke. Don't joke. Because vile nimepitia hali ngumu wewe. Alafu unasikia ukiongea hapa kwa mtandao. Ngoja kidogo mami. Don't joke because I swear before God. Wewe kama una cancer, please. Mimi nimekuwa kwa cancer for long. Na wewe unasema ati umefanyiwa hivi, unaenda hivi, unapeleka watu hivi. Hakuna kitu kama hiyo umefanyiwa. Kitu ya kwanza unafanyiwa MRI. Na ukitaka nifungulie kamera naweza kuonyesha MRI ni gani. Umefanyiwa MRI?
Guys,
kama udema anajua ani sidhani
hata ajui ni nini.
Guys,
Aki, God forbid. Wewe unafanya sisi tumeumia tusikie vibaya. Hata tuwezi saidika kwa sababu ya
Can I say something?
Yes, very okay. Let's invite quickly then Smiley, Jackie Mati then you. Okay, so White, I'm listening White.
Mtandao nimekuwa kwa live.
Nimeingia kwa kama story inaendelea. So nataka tu kuuliza swali moja. Mbona tunamquestion? Anataka mchango ama
that's a very good. No, actually, she did not come here to ask for help, but there are people that have helped her before, and they've never had an opportunity to talk to her, to interact with her. And also, Nasra need help. Nasra need help too, and people want the truth.
Okay. Now I understand. Unajua nimepanda hapa because me at the moment niko na cancer patient. Unaona, somebody very close to me. So akisema ako na cancer ilikuwa imenini because nimemwona sana huku TikTok. So ile kitu nashindwa kama ako na cancer na Kenya ana any paper yoyote alikuwa amepimwa Kenya. Unaona? Ako tuna ya Saudi. So mi naona kama mbona haikai ukweli Nasra kama uko mgonjwa. Na mbona hujawahi enda Kenya kama wacha niseme alafu nini utaongea mami? Mbona ajaenda OC hata kama na need help aende OC ndio from OC akuje na papers. Unaona? Because people have been asking her for so long. Because mi huyo mgonjwa wangu kuenda alienda akatolewa nyama. Unaona? Ndio wajue kweli kama ako na kansa. Na Nasra, uliwahi tolewa nyama mahali? Yes. Uliwahi tolewa home ama huku nini Saudi?
Saudi
Arabia. Not in Kenya. Well,
mbona hujaenda? Let me say, Mtandao, I'm tired. Kila kitu ni Saudi. We are done. And you know what, Nasra, what you have done, the reputation, they are very serious people in Kenya who need our help. Wanaumia na cancer. Me, my grandmother died of breast cancer, okay? Whatever you are doing, may God forgive you because we cannot.
Sema ukweli anakaa mgonjwa but sasa
atuambie ona Jackie ni mgonjwa. Kila mtu anaweza jua Jordan, unajua kama ni mgonjwa atuambie ni mgonjwa wapi. We will listen to her, Mtandao, right?
Yeah, I know, guys. I'm sorry. I'm really sorry, guys. Listen, I'm really sorry. I am sorry. I'm very, very sorry for dropping, guys. You're people that I respect. But this was Nasra's story. I don't judge. I listen. And Nasra came here, and she shared a story with us. Nasra, listen. I'm not going to ask you whether it's true or false. But one thing I will tell you is that these people, they love you. Okay, so it's essentially up to you. You know, the podcast is to share your story. Okay, and you've done that. I myself, I cannot even mention that word. See, I don't. In my household, we never talk about that word because I know how scary it is. Okay, so listen. Thank you for coming to my podcast, Nasra. What help do you need from people before we end? So talk to people. What help do you need?
The help that I need is, since huyo mzee alikuja akadanganya hapa hivi, akakuja, he told people a lot of lies and alinyang'anya kila kitu, alichukua everything and he even got married, and uko kulikuwa kwangu, I was the one who bought everything, na pia So like when he started even disturbing me, hata ikafikanga mahali mpaka anakuwa violence, I went live and then nikaonyesha watu mimi nimeenda kwetu. So I went kwetu with hata nguo zangu sikubeba. I left hivyo hivyo.
So what do you so I'm gonna ask you this. Let's make it short. I know we've been here for 2 hours now. What help do you need from TikTokers?
The help that I need is just people supporting me. Nijue sasa when will this reach to an end?
So what's
not staying with me.
So what's that?
Not a good thing. It's a cannula.
Who does it for you? Unaenda wapi, hospitali gani ama which clinic, and why? Why do you have it?
I have it because of pain. You know, I am under painkillers that I cannot stay without. You know.
So you go every day. So do you do that every day? You go for that injection?
Yeah, every day. Every day I have to go. This is around here. It's just ni pharmacy. It's a chemist.
So kila siku they inject that on you. Every day you go to the hospital or to the clinic center and they inject that. And you say that's what's that drug called?
The first they started with the PCM, that is paracetamol. The second one was antibiotics. The third one was morphine, and the last one was tramadol. And tramadol is the one that I've been on since.
It's a strong painkiller, isn't it?
It's a very strong painkiller, and I have niko na prescription hapa. I used even to go for it in KU.
Well, treating what? That prescription. What are they? What is it treating?
So when I went for those tests, kabla nikingojea result sasa, I was in pain all the time. So nilikuwa naenda daktari akaniambia eti hiyo ndio painkillers yenye wanapeanga watu wa cancer, and nikakuwa naandikiwa. I have a lot of prescription hapa hivi, niko na papers mingi sana za prescription.
Okay.
So whenever I could get in pain, I was going there. Alafu pia nishaipata accident, sinanga mbavu moja ya on the right side.
Accident?
Yeah, so like I was really going through enough pain.
Listen, Nasra, I empathize with you, and I'm very sorry for what you're going through. One thing I will agree with those people that come up here is that they just want to see what diagnosis and where was it done. If you can go back to KU, Nasra, enda KU kesho, okay? Go for your results and come back. I'm very happy to host you again. Or you can go to, listen, I'm a very small TikToker, but Babet Salisha, Hannah Benta, they will take you back. Oh no, just do this, Nasra. Enda, Nasra. So you've done the test, ujapata results. Go to KU, Nasra. Nasra, look at me, listen to me now, okay? Nasra, listen to me.
That is going to be okay, like repeating all that, unajua.
Don't repeat. They have done the test. It's for you to go for the results now.
Yeah, I will go for the results because I have never seen my own results.
Right. So listen.
So
we are
gonna start now.
So Nasra. Nasra. Yes, okay. Yes, all the people. Then that's fine. I mean, if you really need help from these people, okay, and this happens, once you open yourself, people will continue interrogating, people continue asking, and some of the questions might be intimidating, but that's the nature of social media. Okay, you've opened up to us, so people are questioning everything. Okay, and you just need to continue being that strong and give them what they want. So just to show documentary story to Nasra, okay? You go for your tests, okay? Kama mtaanza tena, you go to KU, let them know ulianza test wapi when, and whether those results they can still stand or you need to repeat. Unasikia Mafia?
Okay.
So you go to hospital, malulifanyia tests, okay? Let them know when you did that test, whether those results can still stand for the diagnosis, and then we start from there. Okay? There are lots of TikTokers that will support you, Nasra. But just give them those papers, okay? And yeah, I know I spoke to you on the phone, and personally, Nasra, I'm very sorry. I really am sorry. Those that want to support Nasra, friends, her number is on the bio, okay? Her inbox is open. Support if you want to. But from this podcast now, Nasra tunasikizana kwamba you'll go to KU, okay? Nasra, listen to me. Nasra, look at me, I'm talking to you. Okay? So go to KU. Let them know when those tests were done, ask for the results, and then they diagnose you. Listen, I do not wish anyone to have that kind of disease. I know it's right now in every 3 people in Kenya, 2 have cancer. Okay, so you know it's a very deadly disease, and the earlier you catch it, the better. People in the comment section that are mocking this girl, guys, don't do that. Do not do that. This, hakuna mtu anajua when this will happen to them. Let us be compassionate. Let us pray for her and encourage her. Okay. So Nasra, I'm gonna end this podcast by first thanking you for for coming to my podcast twice. Okay. You've been very brave. You've been there for 2 hours listening to us. I thank you, and I give you. I'll give you one for that. So thank you very much, Nasra. And let's say we shall.
Now, are you going to help me get the car back so that I can sell it out?
What do you need?
Myself,
you want your car back? Okay.
Yeah, I want my car back, and I don't want anything to do with that boy because he's not a good person.
Where do we start? How do you want me to do that? I mean, say ako wapi? Any TikToker?
Yeah, he's a TikToker.
Okay, and it
Sijui hata jina yake alichange anajiita nani.
Dula, I'm sorry, Dula. Listen, all those people that are on the guest section, I respect you guys, and you know that. You guys, I do respect you. I really do. But for now, please allow me just to end the podcast. We've been here for 2 hours, and I've got duty of care as well. This girl is not sick. Whether they have been diagnosed or not, this lady is not well. She's been here for 2 hours. I've got duty of care. So I understand your questions. And I can see the interest. But for now, I'm afraid we're just going to end the podcast. Nasra, these people, they won't support you, okay? You go and get those legit papers. Peter Kioi has a very big platform. Peter support you. Dula mwenyewe kuna big platform. And come back here if you want. And also Baba Talisha, reach out to them, okay? If Baba Talisha, if you are here, okay, there's a reason why they bought a car. And she'll explain. Go to Anabenta. These are TikTokers that can change your life, Nasra. But they will only do that if you have the right paperwork. So Nasra, about the car. I mean, you go to police. Go and report. Okay, go and report to the police what you have told us, and then start it from there. There are lots of platforms. Look, this is say the Tino kuna koti. You can take her to Lady Jacqueline. Lady Jacqueline can give that visibility. You can take her to Auka Junior, or you can take her to Malisafi. I mean, there are platforms that can help you magnify your problem, magnify your challenges. So Nasra, are you listening to me, Nasra? So go upande wa gari, if you want that car back, okay, there are those platforms that can help you get your car back. Okay?
Which are those? Because I really need that car back, because that guy hakuna kitu yenye alichangia kwa maisha yangu. He's just there to destroy my peace and taking away my things, Okay. Kwa hiyo nyumba hata nikimwambia atoke, when he sold out vitu zake alikujanga tu na TV kwa nyumba. Nikiweza mwambia atoke aende, hakuna kitu yake iko kwa hiyo nyumba, hata nini, hata nguo zenye anavaaga ni zangu. Alikuwa ameishiwa hiyo time.
Right. Now do this, Nasra, okay? About TikTok, there is the court, Lady Jacqueline. Okay, do you know Lady Jacqueline? There's Malisafi. Malisafi has got a court, or Auka Junior. These are people that they can provide the platform, the opportunity to talk about it, and they can help that guy to come and be responsible. I think if you want to use TikTok, that's how to do it. There are lots of people with bigger platforms. Even Peter Q himself will help you. So if you want that scam, go to those 3 platforms. Okay?
Can I say something?
Yes, please, yes, please, carry on.
So I have remembered something when I went to KU, to go for the resorts. Kuna mtu mmoja hapo hivyo mali penye resorts zinakuanga za watu wa cancer. That is kuna doc mmoja mwenye aliniambia I should look on what I will tell my people. Eti nijue venye nitaambia watu wangu.
Watu gani?
Nikamuuliza si obviously hiyo kupelekwa hiyo biopsies, unajua ni watu wa TikTok walikuwa wamenilipia, so I was live all the time. So nikaambia daktari nimelipiwa na watu wa TikTok and they want to see everything. Now when I went back, kuna huyo daktari mmoja mwenye aliniambia eti niende nitafute venye nitaambia watu wangu, and I didn't understand why he could tell me that, na hakuwahi niongelesha tena. So I was just going there, naambiwa hayuko, naenda naambiwa daktari hayuko. So ikafikanga mahali I'm just going for the painkillers only, and the guy told me to believe in myself. Cancer sijui ni ugonjwa ya shetani, a lot of, so me I decided to be positive, na nikasema kitu yenye itanihapenia ni sawa tu inihapenie. Me so the papers that I'm having here mingi zake ni za the painkillers.
Okay, and that's listen. So we're just
all of this, you see all this.
Is it really?
The papers, a lot of them, like kuna hii ya ile request yenye nilikuwa nimekuambia, kuna hii ya Saudi, the one with the diagnosis and the history, and kuna hii ni prescription ya dawa. So
okay, Nasra, listen. Nasra, come to me. Nasra, listen. Nasra,
hey.
Listen, Nasra. Nasra, listen, Nasra. Nasra, listen. Okay, listen to me, Nasra. Okay. As far as I'm concerned, nobody's doubting you. Okay, it's because of the tradition we are seeing on TikTok now. People come, okay, they share their stories, and it happens to be not true, and that is why there's called evidence and receipts. Please, if you really want support from these guys, you go to KU, okay, let them know what you've done at that hospital. Go take your papers with you. Okay. So now show them those you've done. Okay. Alafu. Okay, Lina, listen, Lina, I've tried. No, nakujua. Okay, Lina, nakujua. Okay, najamaza. Lina, I know who you are. Okay, I will. Okay, Lina, you're very lucky. I know who you are. Nasra, please, can you assure me you will go to Kenyatta University Hospital, wherever unaenda, and ask for your results. So,
I'm on a serious back pain. I cannot travel for long distance right now. So you will just give me enough time, and then I will let you know nimeenda na nimefanywa hizo zote zenye unataka, but I feel so bad kurudia kila kitu, you know, but it's okay. I will, so that nijue if it is not cancer again, so nijue ni nini inanisumbua, because hata mimi tunaona I don't look okay.
Wait, so hautaenda saizi bado?
Sasa unajua sasa niko ushago, sasa niko kwa mama yangu, niko ushago sasa.
Ushago wapi?
So traveling to Nairobi, it's 4 hours from now. I'm in a place called Loitoktok Senate, you know. Yeah, I have to travel from here to Nairobi, then nitoke Nairobi town niende mpaka Kahawa West. It's a long journey. And for
Okay,
real,
let's end it.
Mtandao podcast from Nasra's home to Nairobi. If it will take long, is 2 hours 30 minutes. I know it is EasyNet. Don't you live at EasyNet?
yes.
Thank you. Again, in this Nairobi, I will decide to find a way that you get hosted by someone or you sleep at a comfortable place. Na gari za kutoka Loitoktok kuja Nairobi, they are more comfortable. Hata kuna super coach, kuna gani, unachagua ile unataka. Unataka gani? Hata tunaweza tumia yako. Unataka gani? Unataka mafuta. So again, Nasra, ukifika huku matibabu na kupimwa, ipimwe na utuletee results sasa, tujue sio leukemia, ni kitu ingine. But let me tell you, Nasra, a very point blank thing. Nimeona wagonjwa wa cancer stage 3 na leukemia. Trust you me, Nasra. Yani hapa Wakikamba wanasema ni birthday. Sielewi maana yake, lakini sijui. Lakini wewe ukitaka tunataka utravel kesho, inawezekana?
I can sacrifice myself, but I'm not okay. Mgongo inaniuma vibaya.
Don't sacrifice yourself. Stop saying you're sacrificing because you're not doing it for anyone. Yani leo Nasra, ukiambiwa kuna mtu ambao anakusaidia uende hospitali, you sacrifice again. Nyamaza. Una sacrifice nini?
Kujitolea kwenda.
It's your health though.
Yani leo mimi niambiwe, mtandao, today you offer me that I'm sick and bad, and you offer me that nothing that I will pay.
I'll take it now.
Utakuja hivyo vile uko.
Right now.
Kazi yako ni kuoga, tunakuingia kwa gari.
Right now. There are people right.
Nasra, bado hiyo ni sacrificing. Hiyo ni sacrificing.
It's okay.
Nasra, the offer is there.
So, okay. Wacha tumalize hii hapa hivi. Official Nasra, Nairobi kesho ni siku mzuri sana kwa sababu hata ni siku ya soko ya Kimana. Si ndio? Kwa hivyo flow ya magari iko na ziko type zote. Je, tuku expect Nairobi saa ngapi?
Nitatoka asubuhi. Sasa nitaanza communicating the moment ninaenda kupanda gari, nitakuwa live. I will just go live muone. Fika. Yeah. Nitaingia live, like I will show you guys.
Tunataka sasa usafiri. Unaona wakati unaingia live, wewe kazi yako ni kujibeba wewe mwili yako tu. Uingie kwa gari. Ukifika penye unafika, sisi tuko updated. Tutakuchukua kutoka Nairobi. Sio mimi peke yangu. Utakutana na watu wengine, tutakupeleka vizuri. Hata Petakei ataingia kwa hiyo hospitali ndani, ndakaa nje kwa gate. Muende mfanyiwe test zote, zitoke zikiwa clean na zikiwa mpaka na QR code. So unajua kuna siku hizi kuna QR code na scan. Itoke nazo, tukuje tujue sio cancer, ni kitu kingine. Maana hata wewe sasa hujui kenye unasafa, si ndio? Yeah. Say hujui kenye you are suffering from, so we want to know tomorrow what you are going through. So thank you so much. At least now we can know that what you are going through. Ya si kama kitambo unameza tu madawa na ujui nini inaendelea. So tunataka kujua kuanzia kesho what you are suffering from. Si sawa? Fare yako ndakuchagulia mtu hapa atalipa haraka, ni team MVP najua. So fare yako acha tu nikwambia haraka. Itatumwa saa hii tulia tutaona. Fare ya kutoka Nairobi mpaka kutoka huko mahali huko mpaka Nairobi ni shilingi 700, lakini nataka utumie 1000 ndio upate matunda kwa njia na maji. Kwa hivyo utatumaniwa na mtu anaitwa John Tez hapa kwa comment section. John Tez atakutumia hiyo. So utatumiwa hiyo 1k. Si sawa?
Kita. Okay, ama tukipatana. So I wanted you to help me get back the car. Me, I don't want that.
No. About the car is a different case. we are talking about sickness medication. Tunataka upone kwanza ndio uweze ukanyanga gari. Gari yako itakuja tu usijali. Lakini tunataka upone. So right now we are dealing about a case of sickness. Unataka gani ikuja kwanza? Ndaenda na hiyo unataka ya kwanza. Ni gari unataka ikuwe ya kwanza ama ni sickness ni gani?
Ni sickness.
Okay, sawa. So kesho tunavyo expect saa ngapi exactly Nairobi?
You know, I don't know how my tomorrow will be. Kama jana usiku mzima sijalala, nimelala nikizunguka huku na huko.
Fanya hivi, Nasra. Nasra,
so,
fanya hivi Nasra, ikuwe rahisi sana. Naomba ulale kabisa. Lala tu, kesho uamke ulale tena. Bye.
Why?
Wait, Nasra, you know Peter Kio, you can literally change
that is the deal now.
Yeah, welcome to this story. Wait, you know Peter Kio, you can literally change your life. Guys, I need to hand. Dylan's here talking. Let's be actually the man too. Okay, guys, I need to finish this podcast. Hang on. Where's so Nasra? Nasra, you know, so you turned down Peter's hair.
Sorry?
So you've turned down Peter Kio's offer.
Yeah, see, I've accepted it.
No, you've not. You've turned it down. Peter's asked you. What time?
This lady is wasting your time and the precious time of other 1,600 people. Because umeona hata venye amecheka. Like she's joking, literally joking, you know.
Ulikuwa unataka nilie. Si Peter Kio ameniongelesha rude. Ulikuwa unataka nifanye?
Nasra?
Mtandao mimi nataka nipeane support yangu nishuke nilale, sawa? Unajua, ngoja niwaambie ukweli. Ile time sisi wenyewe tuna support na tunablokiwa, tuwanga atupeani mawaidha, si ndio? Lakini umemleta hapa yeye mwenyewe aseme story yake. Hakuna kitu painful kama unajizika wewe mwenyewe Nasra. Unakufa peke yako, unajizika wewe mwenyewe peke yako, unaona? Wewe mwenyewe ndio unajua ukweli wako wewe mwenyewe peke yako. Kwa hivyo kama hii kitu yako ni real, atusemi si real, yes wewe ni mgonjwa. Hakuna vile unaweza tumia documents za Saudia kwenye hospitali za Kenya. Haiwezekani hata na madawa. Wewe chukua jahazi, chukua mtu yoyote, endeni moja kwa moja na mtu mwingine wa mkono. Enda kwenye hospitali, utibiwe, uangaliwe. Tutakusupport from there. Mimi ndo nilikuwa CRBR pale kwa baba Talisha tukikuchangia. Mimi nasikia mauchungu sababu wewe mwenyewe ulienda kununua gari. Na tulikuwa tumeagree hizo pesa ziko za matibabu. Unaona? Pia sisi tunachoka.
Listen. The reason as why nilikubali hiyo offer ya kununua gari because siko nataka kushindanga nikiwa.
Well, listen. Nasra, these are
mtandao.
Ni sawa. Vile TikTokers waliagree last time na kina Chaz na kina Peter. Nasra, hata demo amekuja hapa akajitokeza akakwambia atakupa gari for free. Wewe mwenyewe usafirishwe kama VIP, utulie kwenye gari, upelekwe KU, uende uangaliwe. Na tuchukue jahazi. Na ndo tumesema ni sawa, unajua usiwe mwepesi wa kubishana Nasra. Ndo tumesema wewe jipange sasa, hata ukitaka za sharubati tutakupea. Jipange, chukua jahazi, mwenye amesema atapena gari, tuteka mafuta, enda KU, hata kama ni kuanza mwanzo. Jitume mama, ugonjwa ni wako. Wewe mwenyewe ndio wafa polepole. Wewe mwenyewe ndio unajijua. Wewe ndio uko kwenye huko. Na hakuna kitu mbaya kama kujimbia kaburi yako.
Alinidanganya Nakuru. Alinidanganya ako Nakuru. Nikatoka Nairobi juzi, nikaenda Nakuru. Kwenda Nakuru kumwangalia, kufika Nakuru akaniambia sijui alihamia wapi. Alinidanganya.
Sasa unatakaje?
You see? Now, this lady is wasting our time. And number one, nimesikia ati alichangiwa na Baba T. Ali, alichangiwa na Baba T, alafu anaenda kununua gari. Like,
what you are
anachangiwa
doing.
na
You're
Baba T,
not
ananunua gari.
sick.
Okay,
Gonjwa, not sick.
Wewe mtandao, hebu pandishe chazi hapo mtandao. Hebu pandishe chazi hapa.
Okay. Junior, I'm listening. Carry on, Junior.
Sema, this lady is not serious. Number one, either this lady, cancer is a very serious thing. I've been here just listening. Ajui hata diagnosis ni nini, ati anapewa paracetamol, anapewa antibiotics. Like, that's so weird kind of prescription hata, Then hospitali mara anaenda KU, unaendaje unapimwa, haupewi kopi zako, ati sina, like how, It's strange. Those are your health records. You are the person
Mimi alinidanganya
inafaa upewe.
nikatoka
Hey, Smiley, hey, Smiley, hang on, just a minute.
No. So, two things. Either msichana ni mgonjwa ugonjwa ingine, but not cancer. Awache kuwekea cancer. Guys, cancer is a very serious thing. You can't just come here and joke with.
Au kawacha nilete Kara kwa picture yenu. I'm coming up here kuleta msichana anaitwa Kara. Msichana anaishu kuangalia hivi. Please, just a minute, Smiley. Naleta jina hapa juu, msichana anaitwa Kara, Miss Kara. Kama mtu yote ajui Miss Kara, kila mtu saa hii mwanamke yote mko hapa, endeni muangalie Miss Kara. Ndio huyu amekuja hapa juu. Welcome Miss Kara.
2 years, ana health records. Anachangiwa na Baba T, ananunua gari. What the hell is that? Unachangiwa ujue ni mgonjwa na unaenda kununua gari. Man, it's not making sense. So this girl is wasting our time. There are very serious things that need to be attended to. There are very serious and genuine cases that need to be attended to. Huyu aende atafute gari atajua hata alipeana nani. So huyu akomboka, tumsaidie kuleta gari yake. Wewe venye ulianza, enda umalizie huko. Peace out, man.
Thank you very much. Mtandao, this is Miss Kara. Huyu amekuja hapa juu. Ndio anaitwa Miss Kara, anauza pia cereals. This girl huwa anauza cereals akipata pesa ya kujipeleka chemotherapy. Miss Kara akieleza mambo yake hapa atakuelezea mtandao, atakwambia document after document. This Miss Kara you see here. Miss Kara atakuelezea mpaka treatment yenye amepewa. When you ask Miss Kara bring a document, Miss Kara is ready to bring a document. She doesn't argue, she doesn't show rudeness, she's not a rude girl. Miss Kara anajituma hata kwa hii hali yake kuuza cereals. So kuliko tukae hapa tukisema every time, mimi nimetoka na official Nasra tangu akiwa Saudia up to now, tunatafuta hata namba ya hospitali, ile namba tu huwa unaenda hospitali unapewa, tumekosa. Why can't we also focus? Mbona tukaini kama tuna force? Why can't we focus? Miss Kara is here. Miss Kara, welcome. Say hi to people, Miss Kara.
Thank you for that.
Hi guys.
Obviously, I know Miss Kara. Miss Kara, great to see you here. Thank you for coming, Miss Kara. Obviously, I know your story. I don't want to shut you off, Miss Kara, because today I was talking to official Nasra. But just a quick seconds, say hi to people and tukusikiza.
Okay. So guys, I am Miss Kara, and I was diagnosed with colon cancer in 2020. I have gone through chemotherapy, 12 sessions, 40 sessions of radiotherapy, and 8 sessions of immunotherapy and oral chemo. So recently I was on oral chemo and immunotherapy, and cancer metastasized into my right lungs, my right breast turned black, and part of my brain. They did an MRI recently that is affecting my brain. I get treatment at Aga Khan Hospital. These are my hospital documents, and this is my name, Exvery Onura. My name is Exvery Onura. I've been through, I'm a colorectal cancer diagnosed in 2020. I've been through chemotherapy, radiotherapy, and also surgery. I had surgery in my stomach. I used to go to the toilet using stomach bags. So these were the findings. The findings showed that I'm having nodules of tumor in my lungs, making it thicken, and breathing is becoming difficult. So when they did also the brain MRI, when they realized that my brain is has a tumor, making it suppress my vision, and I forget things. I paid 46,008 at Aga Khan, and even this is my doctor's name. Yeah. So,
Miss Cara, oh goodness me.
The chemo that I'm being given is Langvax and Doxtalimab. That is the name of the chemo medication that I'm being given.
Hey, those people that are writing drop Nasra, I'm gonna block you. Guys, be respectful, please. Those that are writing drop, guys, I do not do that nonsense. I think we follow. Yes, ma'am. Miss Cara, pole sana too. Friends, listen, for those that do not know Miss Cara, obviously I know you are sorry, Miss Cara. Miss Cara also sells rice, and that is how she supports herself. Okay? Maybe some of you have never seen Miss Cara asking for support here. Miss Cara tries to pay for all medication through selling rice. So, guys, if you want rice, you can buy it from Miss Cara. Whatever you spend on her, this lady takes it to the medication. I know her story. We've interacted with her. Charlie, thanks for being back here. So, guys,
Siraj anasema up. Siraj Kabucha anasema up. Thank you.
Siraj Simoni hapo wapi? Guys, I'm afraid guys, I need to end this. This is not easy for me either. Friends, this is not easy for me. Miss Cara kizanani. Aki pole sana.
Pole sana Miss Cara. I want to give you my story too. I was diagnosed with liver cancer in 2020, and I had a liver transplant on January 20th. Kwa hivyo Nasra, kama uko na kansa useme utasaidika. Kama hauna kansa mama, just say usifanye mzaha na hiyo, na we don't say these things lightly. Na sikuja hapa mimi kuomba msaada. I just came here because of you Nasra. Unaona, wacha nikuoneshe. Let me show you something. You see, that's UW medicine.
Oh, Siraj, I didn't know about this.
No, you can't know because I never needed help from anyone. I'm just here because I need to explain something to Nasra. We don't joke with these things. You see the kind of medication that I take on daily basis. So, Nasra, don't joke with cancer. If you have cancer, uache usaidiwe. Kama hauna cancer, mama, don't use it as a reason. It's a very dangerous disease.
Siraj, I didn't know this, Siraj. I mean, we interact. I never knew about this.
You can't because I have everything that I need to take care of myself. God has blessed me. Alhamdulillah, I praise Lord. So, Nasra, kama we ni mgonjwa useme tukusaidie. Kama we si mgonjwa mama, don't do that. Cancer is not something to joke with. It's dangerous. Kama we ni mgonjwa tutakusaidia. Kama hauna cancer mama, don't do that.
Maya, who's this guy called? Maya, you are the most stupid person I've ever seen in my life. I'm gonna block this. You're the second person blocking. That's very disrespectful.
So that's pretty much what I needed to say.
Oh, so
I'm a post-transplant patient, liver cancer, and I'm recovering really well. So kama we ni mgonjwa mama, tutakusaidia. Kama si cancer, don't use that word. It's not a joke. Kukua na hiyo mgonjwa.
Mtandao. When I say something down, I'm not okay.
Okay, just to Rachel Tuma. Hey, Miss Cara, listen, thank you for coming up and for sharing your story with us. Guys, if you are not following Miss Cara, please do that. If you ever want to buy one.
Eskara, ukishuka tunaongea tunaongea kwa WhatsApp.
I was recently given a prognosis and which I haven't been able to talk about, and I'm having less time, guys. But I leave everything in the hands of God.
Pole sana.
Guys, anybody, I consider anybody writing something negative about sexual trauma, I'm gonna block you. Guys, can you be respectful, please? Not allowed.
Mtandao, don't focus on anything watu wanaandika.
Wachana na comment.
Wachana na comment section.
Mtandao una focus na comment section. Mtu anasema kuna next time. Like, can you be objective mtandao for once?
Yeah.
Mtu anasema kuna next time na wewe una focus na
very relax.
badala wachane na wao.
Umesikia kitu Miskara amesema? Leave alone comment section please. Umesikia kitu Miskara amesema?
Let's support Miskara.
Wacha turudi kwa Nasra. Nasra, kama ni wewe ni mgonjwa, just be open, be specific, utasaidiwa. If it's not cancer, don't use it. Please.
Yeah. Nimepanda ndio niongee at least na Nasra.
Okay.
Nasra, you are one person, I think, nilifeel situation yako sana. The way ulikuwa na feel yangu. And the only thing naweza kurequest, toa 2 documents na utasaidika, kindly. Toa 2 documents. Kama we ni msick cancer.
Namba yangu iko kwa bio but naweza soma.
Wasome please.
If mtandao allows me.
Please carry on.
Mtandao kinikubalia nitasoma.
Please carry on. Please write down.
0723.
Somebody say that down and then you shall pin it.
0723 44 11 43. 0723 44 11 43.
Look, guys, listen.
So
mtandao wacha nimalize.
Okay, thank you.
Alafu nishuke.
Okay, Rachel. We need to
Nasra, I think the only thing TikTokers wanataka, these people ni wazuri sana. Kwanza pande ya kusaidia, mimi ni one of them wamenisaidia. Sitakudanganya. But we've never lacked at anything. If umetoa true documents zako za ukweli, wakaona wakaprove, hautakosa kusaidika. So kindly, kama unajua uko na cancer, my sister, please, unajua nakupenda. Hebu tutolee hizo documents. Tafadhali tutolee tu hizo documents. And kama uko na ugonjwa ingine, kuchagua mtu mmoja mwenye utakuwa free na yeye. Mwambie sina cancer, I have this and this. I was wrong, this nikisema cancer na si cancer. Just be open to somebody mwenye ungependa sana kushare na yeye. Najua people will judge you, lakini say the truth usaidike. Hata sisi wenyewe tunaona there is something inakusumbua. Inaweza kuwa si cancer, inaweza kuwa ugonjwa ingine, but unaogopa kutoka kusema. Unaona? Na unaweza saidika before hata iendelee. So kindly na kurequest, unajua nakupenda, na kurequest mbele ya watu. Kama kuna documents zenye uko nayo yenye ulikuwa diagnosed na ugonjwa ingine na si cancer, be truthful, sema na usaidike. Please.
Rachel, thank you. Guys, I'm afraid I'm going to do this now. Siraj, thank you for coming up. I appreciate it. Bula, thank you. Charles, thank you for bringing Miss Nasra up. Guys, if you want rice, please, when you buy rice.
Mtandao naweza waambia jina yangu, wananiuliza jina.
Okay. Just quickly, because it was Nasra's day, so just say it.
Jina
nani?
Okay.
Jina nani?
Jina yako.
Exvaria Honora.
Rudia tena.
Exvaria Honora.
Exvaria Honora, okay.
Exvaria Honora.
There you go. Thanks, Desire man.
Honora.
That's why.
Yeah, so Nasra, before ni drop, please be truth. Yani usema tu ukweli utasaidika. TikTokers ni wazuri, sitakudanganya. These people wanasaidia. Sasa kuchamba pia wanachamba, lakini when it comes to mtu mgonjwa na vile tunakuona we ni msik, watakuja wakusaidie. Bora utoe documents za ukweli.
Guys, thank you.
Tafadhali my dear. Sawa, umenisikia? Tafadhali, tafadhali.
Mtandao, wacha kusema it was Nasra's day. Wacha mwenye anataka support Kara amsupport.
I understand that. But listen, guys, we've been here for 2 hours. Okay,
it was
honestly,
Nasra's day, but Kara is here.
I know. And you've listened to, guys, listen, okay? Again, you've heard that short story of Miss Kara, okay? It's a tragedy. If you want to support Miss Kara, if you want to buy rice, you go to her. She only she says 200 shillings per kilo, right? 200 shillings? Miss Kara, how much is it? So Miss Kara, even though she's not well, she still wants to support her family. She's still paying for our diagnosis. For health. So if you buy rice from Kara, you're not just buying rice, but you're also supporting her in her journey to get healthy again. And for those that have a small, strong faith, keep praying for these people. Okay, and let's pray for each other as well, including Nasra. Guys, I cannot thank enough. Siraj, I am heartbroken, and I wish you well, man. I never knew.
No, I'm doing great, man. I just got my transplant on the 20th of January, and I'm walking around. I'm doing great.
Man, I never.
All what I need from anyone here on TikTok, just pray for me. God has blessed me. I have everything. I went through everything. It's all covered under my insurance. So I'm just here to talk to Nasra one-on-one, because if she's sick, we can help her. We can help her. We are out here.
Yeah.
All what we need is truth and the facts.
What's that? Are you getting stuff, Kara? Guys, thank you.
Yeah.
I'm afraid, friends, I'm going to end the live now. Charles, thank you for coming up. It's always a pleasure seeing you. Rachel Truoma, your support is always appreciated. Thank you. Sarah, thanks for coming up. And again, I wish you well, man. Thank you very much for coming up. Thank you. Miss Kara.
It's okay, Mtandao. God will give me another day. You can just end the live.
Nasra, last words before you end. Nasra.
No, we just want to know.
Thank you for coming to my podcast, and thank you for your time. I appreciate it.
Anytime.
Thank you very much, and I wish you all the best.